Hi guys, my name is Stephanie Burhop, and today my group is going to be talking about parental formulations and how they can be designed into mixtures of dextrose and amino acids like the 2-in-1 or dextrose with amino acids and lipids like the 3-in-1. We're going to talk about any advantages to each of these systems. So to begin, what is PN? Well, PN is when nutrients are delivered via the bloodstream. Central parental nutrition is when nutrition is delivered by the central vein, and peripheral parental nutrition is when the nutrition is delivered into a smaller or peripheral vein. So EN is the preferred method like we've been talking about, but PN is necessary in certain cases, like when a patient has failed EN. That could be due to severe acute pancreatitis, short bowel syndrome, mesocentric ischemia, paralytic ileus, a small bowel obstruction, a GI fistula, or if EN hasn't been administered for 7 to 10 days. So PN is administered through a catheter lumens or an implantable port. So there are two types of PN. We have a 2-in-1 and a 3-in-1. Every PN solution contains protein, carbohydrates, and fat. So they get their protein as amino acids, carbohydrates as dextrose, and fat as lipid emulsion. So the solution also contains any electrolytes, vitamins, minerals, as well as any other medication that this patient needs. So a 2-in-1 solution is there's a bag of dextrose and amino acids, which is in a 1-liter bag, and lipids being kind of delivered as a piggyback every day or intermediately. The bag of amino acids and dextrose is kind of a yellow looking bag, and the bag of lipids is going to be kind of a white looking bag. The lactose in the lipids gives it that white kind of creamy look. The 3-in-1 solution is when dextrose, amino acids, and lipids and any other additives are all mixed into one bag and administered to the patient. So in this case, it's going to be like a white color because the lipids, the lactose in the lipids is making it white. So, and also lipids are provided as a part of like PN daily, and it becomes a really important source of energy. So PN is always either going to be administered continuously or like on a cycle. The continuous infusion is the more tolerated one, and it's best, but a cyclic kind of infusion is more ideal for at-home PN. For both the 2-in-1 and the 3-in-1, the main energy source is going to be dextrose. So you're going to want that to be 50 to 65% of your total calories, and there's 3.4 kcals for every gram for dextrose. When amino acids are administered, this is the source of protein like we talked about, and it's recommended that amino acids be 15 to 25% of the total calories, and there's 4 kcals for every gram for amino acids. Lipids are used as an energy source as well. Soybean oil is the primary soy source, but it can be pro-inflammatory, and the sterol in the soybean oil is thought to cause intestinal failure. So an alternative to soybean oil could be things like olive oil or fish oil, and the lipids have 10 kcals per gram. So the initial rate that you want to administer PN is no more than 0.3 milliliters per gram or per kilogram, and this increases to get to the goal rate. PN solutions should be changed every 24 hours, so meaning changing the bag every 24 hours, and the maintenance fluids can also be changed at this time. It's better to do it at the same time just to prevent any confusion with the fluid prescription. It's also really important to remember that with PN, the solutions are dispensed by the pharmacy. So although you make a prescription, The pharmacy might not write it for a while, and it could take a while for it to even get administered to the patient, so you have to keep that in mind when you're taking the blood work, knowing what they've been given and how long they've had that for. Hospitals differ on whether they prefer the 2-in-1 and 3-in-1. For example, some believe that the 2-in-1 is less microbial friendly, but Aspen, the American Society for Parenteral Nutrition, wrote an article about how the 3-in-1 is a safer choice because they're only infusing like one solution. So there are many reasons that professionals prefer one over the other, and Peyton and Jessica are going to go over the advantages of both the 2-in-1 and the 3-in-1.
My name is Jessica, and I will be discussing the advantages of using a 2-in-1 formula over a 3-in-1 formula. So, a 2-in-1 formula is a type of PN that consists of a mixture of only amino acids and dextrose. An intravenous fat emulsion, or an IVFE, can be administered separately. This means that there are 2 bags hooked up to a patient's line, one bag with a mixture of dextrose and aminos, and a bag containing only IVF. There are several concerns healthcare professionals may have when deciding whether to use a 2-in-1 or a 3-in-1 formula. These concerns are that of microbial contamination of the formula via IVFE, the stability of the emulsion, and calcium phosphate precipitation from the emulsion. 2-in-1 formulas have advantages in all of these categories, and that's what I'll be discussing today. It has been suggested that IVFEs are immune from microbial contamination of PN formulas. This is due to the abundance of nutrients within the mixture and the conditions of the IVFE, which are basic, and that's in comparison to the acidic mixture of aminos and dextrose. Adding IVFEs to a solution of aminos and dextrose could make the overall solution less acidic, so more basic, and basically increasing its pH, and therefore more hospitable to microorganisms. These more hospitable conditions can potentially allow for bacteria to flourish more so than they would be able to in a 2-in-1 formula, so of aminos and dextrose. So basically they'd be able to flourish more in this more basic solution compared to the very acidic 2-in-1 solution. One study demonstrated a 5.8-fold increase in staph bacteria associated with IVFE infusions. While this is alarming, larger studies have found no statistical difference. So it's kind of contested whether or not this poses an actual threat to patients on PN. But for this reason, an advantage of 2-in-1 formulas is a potential reduced risk of microbial contamination. The stability of PN formulas is the greatest concern of healthcare professionals when administering PN. IVFEs, as denoted by the name, are emulsions, meaning that they only are kept stable by an emulsifying agent. So the emulsifying agent keeps the lipid globules suspended in the solution. The addition of IVFE to the acidic mixture of dextrose and amino acids can cause lipid globule coalescence, which is also called cracking. When cracking occurs, large globules of lipids precipitate from the formula and are just present in the solution. This is problematic because if a formula in which IVFE has cracked is infused into a patient's bloodstream, there are potential life-threatening complications. To avoid cracking, IVFE should be kept out of the 2-in-1 formula of dextrose and amino acids. Calcium phosphate precipitation is also a concern of 3-in-1 formulas. This happens when the pH of the solution is raised, which can be due to the addition of basic IVFE, as we learned before, and calcium phosphate precipitates out of the solution. Calcium phosphate precipitation is similar to cracking because they both have life-threatening complications. 2-in-1 formulas are advantageous as they reduce risk of both cracking and calcium phosphate precipitation, and they also pose less of a risk of microbial contamination. These advantages are obstacles in 3-in-1 formulas, which are more cost-effective. We will now hear from Peyton about what advantages 3-in-1 mixtures have and some ways that we can overcome the issues with 2-in-1 formulas.
One type of parenteral nutrition to be considered is total nutrient admixture, or TNA, which is just another term for 3-in-1. So this type of parenteral nutrition is composed of dextrose, amino acids, and your intravenous fat emulsion, or IVFE, which is all placed in a single bag and can be administered simultaneously to the patient. So it can be safely administered to the patient with all the components found in a single serving per se. Whereas if you did your 2-in-1, you're going to have your amino acids and your dextrose in one bag, and then you'll have to give the patient an additional bag that has your fat in it. TNA requires minimal manipulation at the hands of the pharmacist, since it is a single bag, so that can decrease the risk of catheter contaminations and patient infections. Additionally, since it is just a single bag, it decreases the cost due to decreased nursing time. You're only administering one bag compared to two in your 2-in-1. Decreased equipment costs because you have less equipment since you're only doing one bag instead of two. And then lastly, you're going to have a decreased waste of intravenous fat emulsion products. So there's been a little speculation as to which one is superior, the 2-in-1 compared to the 3-in-1 or that TNA. But the use of TNA is considered conventionally acceptable and preferred in most institutional and home settings. However, obviously this is something that is dependent on the patient's status and the health of the individual. As I just mentioned, considering when to use TNA versus 2-in-1 is dependent on the health status of the patient and any chances of them getting microbial contamination and ensuing infectious complications. So TNA is aseptically prepared by a pharmacist using a mechanical and pretty structured process, limiting the amount of human errors and maximizing precision due to this machine usage. The product that is created from the pharmacist is considered a sterile formula. Since TNA is prepared in a single bag and manipulation is minimized through this creation, it decreases the risk for contamination and infections to stem from this product. In addition to the safety behind this single manipulation, there's also decreased time that goes into it, since it is only being manipulated once, which can allow for the nutrition to be implemented at a quicker speed. Some people argue that having the additional ingredient found in the 3-in-1 solution is going to increase your time because the pharmacist is going to have to add that additional ingredient, which is true. The pharmacist will have to add that additional ingredient into the formula, but on the long term, it's going to result in extremely decreased time during that nursing period. Research has shown that the administrative time discrepancy between the 2-in-1 compared to the 3-in-1 is nearly double. So, whereas 2-in-1 formula takes about 4.5 hours to administer, 3-in-1 formula only takes about 2.5 hours. So you're saving a lot of time when using this standardized kind of communal formula compared to something that is requiring the amino acids in your dextrose and then an additional fat administration. Because of the saved time associated with 3-in-1 nutrition, many nursing staff and hospitals prefer this particular type of parenteral nutrition. Additionally, with decreased time, there's also decreased costs, having to pay for the laborers and having to pay for those additional tubes and equipment associated with that additional bag of parenteral nutrition. Additionally, many patients prefer 3-in-1 nutrition because it is a more simple, more efficient way of administering nutrition, since it is just run continuously from one bag instead of having to do the one bag of the amino acids in the dextrose followed by an additional bag of fat.